Everybody. Thank you so much for joining us this evening for this, what's going to be a really interesting session on how you can benefit from the NCHPAD Connect program. NCHPAD was founded in 1999, and it's the National Center on Health, Physical Activity, and Disability. And the NCHPAD Connect program provides access to individualized programs and personalized resources that you're going to hear all about this evening. My name is Juanita Panliner. I'm the Spina Bifida Association's National Resource Center Manager. And with us today is a wonderful member of our staff, Judy Thibodeau. She's SBA's National Director on Resources and Research and Services. And I wanted to mention a couple of things before we get started. It's a webinar, and you will be muted throughout the session. But we definitely encourage you to please submit your questions through the chat or through the question feature. If you registered, which if you're here, it means you're registered, you will get a recording of this session. And in the next few days, we'll make the session available through YouTube as well. We've enabled closed captioning. If you have any technical issues, you may send me a text message. My number is 202-487-3988. And now I'm so pleased to introduce our speakers. We've got Robin Gaines-Lanzi. She's a professor of health behavior, psychology, adolescent medicine at the University of Alabama at Birmingham. And she's the National Director of Community Engagement and Translational Sciences at NCHPAD. And Betsy Hobson is the Director of the STEP program. She's staging transition, which means staging transition for every patient, and the Director of the Spina Bifida program at Children's of Alabama at the University of Alabama at Birmingham. And so enough of me. And so now we wanted to welcome Robin and Betsy.
Thank you so much, Juanita. It's a pleasure to be here. Very excited to share a little bit about NCHPAD Connect and the wonderful programs and resources and supportive online community. And I will throw it over to Betsy if she has anything else she would like to say before we begin.
Hey, thank you, Robin, and thank you, Juanita and Judy. It's a pleasure to be here tonight, and I'm really excited to share with the greater Spina Bifida community about the wonderful services that are available through NCHPAD.
Awesome. Let's see if I can. Okay, and as Juanita shared, NCHPAD, or the National Center on Health, Physical Activity, and Disability, has been in existence actually since 1999, so 25 years celebrating this year, and originally starting out as this public health resource center that is available nationally to anyone, and has lots of information around health promotion for people living with mobility disabilities and or chronic health conditions, things that impact their ability to ambulate, and originally featuring mainly online resources. But with this last round of support from the CDC, it has expanded to offering wellness programs and really honing in on sort of the mind, body, and what feeds our souls. And so a variety of resources, services, and programs on health, but drilling down to what can we do in terms of nutrition or fitness, mindfulness, and overall well-being, specifically tailored to those of us living with mobility limitations. And NCHPAD Connect specifically is the specific new mechanism for providing online free resources and programs that we'll get into in just a second.
So after spending the last 20 years working in spina bifida clinics, both pediatric and adult clinics, I have seen firsthand how important health and wellness is for all of us, but especially during the time period from transition to adult care. And that really led me to want to partner with NCHPAD for my patients. And after I was able to see all of the benefits that are completely free and the resources that are available, I thought this was really too great to keep just in Alabama, that really everyone in the country could benefit from this. I'm very passionate about providing care to people across the country and sharing the resources that we have. And NCHPAD's a great resource that regardless of where you live, it can be utilized and it can be in your own backyard because of just how accessible all of the programs are. So Robin, would you show a quick video to give people a better introduction to NCHPAD?
Absolutely. Here you go.
Have you ever wished you could have access to an online network of wellness programs, health experts, and resources? Well, now you can with NCHPAD Connect. NCHPAD Connect is our online portal that links you up with resources, communities, and wellness programs that are specifically tailored to people with a wide range of physical disabilities. How does it work? First, you need to sign up for our portal, NCHPAD Connect. After you sign up, a member of the NCHPAD Connect team will call to set you up with programs and resources that best fit your needs. So what exactly will you have access to? NCHPAD Connect gives you access to all kinds of individualized programs and personalized resources on mindfulness, exercise, nutrition, diet, and weight management, all at no cost to you. These programs will connect you to a team of health and exercise coaches, mindfulness instructors, nutritionists, and mental health experts who will help you to navigate daily health and wellness. With each program, we'll also send you an inclusive wellness box tailored to your individual needs. Depending on the program, your wellness box could include anything from a water bottle or weights to a yoga mat or journal, all helping you on your health and wellness journey. We'll even send you free coffee and snacks when you join our coffee club. We believe that anyone can reach their health goals with the right team. Connect to a healthier future today by visiting ncpadconnect.org or calling 866-866-8896. Have you ever wished you could have access?
Sorry. Trying to go to the next slide. There we go. So hopefully they gave you a little introduction and overview of what NCHPAD is about and opportunities to engage in health and wellness. And so one of the wonderful things that I think is such a hidden gem about NCHPAD is what I like to call sort of a free social worker. It has an inclusion specialist. We have a technical assistance center that is available 7 a.m. to 7 p.m. Monday through Friday. If you are part of the NCHPAD Connect portal, and we'll get into that in a second, but it's a very easy process to get enrolled into the NCHPAD Connect portal. And once you are, then you have access to a person that you can call at our technical assistance center, like I said, from 7 a.m. to 7 p.m. Monday through Friday. And ask any health related question that you might have. And they can also point you to online resources in our directory that's been in development for the past 25 years. So it's a really cool thing that is offered unique to NCHPAD, I think, across the country. Oh, Betsy, you're muted.
So when you sign up for NCHPAD, there are a number of programs that you will have instant access to. So like Robin mentioned, immediately through the Connect program, you'll have access to that resource hub where you can really call with any question. In addition to that, there are a number of programs, and we'll go into each of these 4 programs in greater detail in just a second. So Robin, if you want to advance, I'll talk first about the mentor program.
Absolutely.
So mentor stands for mindfulness, exercise, and nutrition to optimize resilience. You can go on one more. And so this program is an 8-week program that is group-based. It's online, and you get one-on-one health coaching. One of the other things I love about this program is by signing up for this, you're going to get a box in the mail that has lots of free things for you. And who doesn't love free things? But all of it is designed to optimize your health in these key areas. We've got a video here that we can show you that'll tell you a little bit more about Mentor.
If you're ready to nurture your mind, body, and spirit on a new wellness journey, we're here for you. Mentor is a free 8-week wellness program consisting of mindfulness, exercise, and nutrition. It was created by health experts and designed to prevent health issues associated with your disability or recent diagnosis. Every part of our individually tailored, holistic wellness program is focused on you because you aren't on your wellness journey alone. We're on a journey.
Oh, sorry.
Yeah, so that basically just finished saying we're on the journey with you. And so through this program, there's your opportunity to connect with health experts. And again, all of this is completely free to you.
If you're
Sorry, it keeps catch me up there. So one of the portal in which we are connecting, it's wonderful. It does also have, you can use it on your phone, so you do not need to be connected to your laptop or a computer. And it's through this portal called Healthy that is all HIPAA compliant, which meaning you can rest assured that your information is being protected. And it's really a cool way for those who are just in your group to communicate with each other as well as communicating with your coach. And with Mentor, you really get 3 different coaches. You get a coach for your mindfulness on Mondays, and then for your fitness coach, that's on Tuesdays and Thursdays, and then a Wednesday coach who's coaching specifically on nutrition. And then your Friday with your group is your health coach, who is really talking and drilling down on those sort of mind, body, spirit, and not religion, but more just what's feeding kind of your soul and what supports you and what you might need. So it's a really great way to, beyond that hour that you're spending with them daily, you can communicate through the portal there. And the next really one that I love talking about, because it's one that I was really fortunate to be asked to help develop. And I love the name that we came up with. It's Growth, and stands for Growing Resilience out of Wellness and Thoughtful Habits. And it really focuses on your mental well-being. And I kind of think of it as your sort of social, emotional, and mental well-being, so that again, you're thinking about more than just your thoughts and your feelings that day, but getting involved with your group and feeling what do I need? And the beautiful part of it is you're going to be connected with others who are journeying with you throughout these weeks. And we designed this one after a lot of work with individuals who are either people with disabilities, their family members, or those in clinics, and to say what is the right amount. And it felt like about 6 weeks, the first week getting to know each other, and then the next 5 weeks where we meet twice a week for an hour, starting off with really recognizing signs of mental well-being, but then when can you identify if you're not doing so well? And you might need to think about if there are signs of distress, and how do you reach out, and who do you reach out to, and what resources are there? And there are many free resources beyond what we're offering. And so we share that. And we get into a lot on coping strategies. So what are some self-coping strategies that we can do to think about ourselves and our internal mechanisms? And the connecting part is connecting to what works for us, connecting to our friends in the group, in the growth group, then looking at connecting to other groups like this wonderful group that we have here that the National Spinal Bifida Association has created, and then getting the resources and supports. And so this really walks you through a lot of what we do. And these, of course, the self-help therapies of cognitive behavioral therapy and acceptance commitment therapy, we do this really in a very high level, like these are things that you can do, but we give you lots of things to carry with you beyond what we do in the class. And we're working on then sort of growing after growth and having some fun groups that we can do after as well.
So the next program that you can be a part of, and I do want to mention that for most of these programs, you can be in them simultaneously. And so this is not like you join NCHPAD and then you have to decide which of these you want to do. Any or all of these are available to you. So the next program is the State of Slim program. And this is a 16-week program that has 3 phases. There's also a social component to this. We all know that we are much more effective with any time we're changing habits around food when we do it in a group or have some accountability. And so that accountability in this program comes from both a certified coach and then also a group of peers who's doing it with you. We've had proven success with this program. So an average weight loss of over 10% at the 16-week mark. And again, with this program, you're going to get a box with some free items in the mail that will get you started on this State of Slim program.
And then another really cool thing that we offer, it's called NCHPAD Coffee Club. And Dr. Jim Rimmer, who is the principal investigator, the person who is responsible for getting this funding for the past 25 years, which is so amazing. He worked with Stephanie Ward, who is another just beautiful person who lights up the room with Dr. Rimmer. And this is every 2 weeks on Zoom. We are just meet and talk about things and focused on, again, sort of this mindfulness, nutrition, and other things that we can be doing to support our well-being, and kind of talking about each of those, and then really opening it up for discussion. It becomes this really lovely support system in and of itself. And by signing up, you get to have coffee, or if you prefer tea, sent to you in the mail with some snacks, and you get a t-shirt and a coffee mug. So lots of things to look forward to. It's Tuesdays at 9:30 Central. Being in Birmingham, we operate, we're on the Central Time Zone. So that's also a really cool thing to do as well. So this slide I want to share with you is just one person's experience being in the different programs, and others. Let's see here.
My name is Dina Deshane, and I live with multiple sclerosis. Joining NCHPAD Connect was easy. First, I joined Mentor. Mentor helped my body become stronger, healthier. I felt more confident in my abilities. Those 8 weeks helped me manage my weight through the informative hands-on nutrition classes. Throughout my time, they've sent me surveys. These surveys, I've given my honest feedback. The feedback, I believe, has helped improve these programs over time. So they're continually evolving and growing and getting better for the next participant. I've participated in several of these specialty programs, and I've walked away from each and every one of them with something positive, something to add to my toolbox, something that helps me be a better me. I would encourage everyone to join NCHPAD Connect. The program helps with your mind, body, and soul, helps you become a more whole human being so that you can help yourself and then help others.
NCHPAD Connect is an online portal connecting you to free, personalized, and adapted resources and health promotion programs. Because we believe that anyone can reach their health goals with the right team. Connect to a healthier future today by clicking on the link in the description.
My name is Dina.
I do that every time. One of the really fun things that we have recently formulated is we have, through the National Community Engagement and Translational Sciences team, created our National Stakeholder Advisory Board, of which Betsy is on, and asked also some of our participants to serve in this role to help guide and develop how best we can reach out, and also to share their experiences with being in NCHPAD. And featured here is Patty Erickson Taylor. And her quote here is, "The programs through NCHPAD have been life-changing for me since my stroke. It has been a lifesaver for me, and I can't be more grateful and thankful for this program." And Patty has done so much she is in Cape Cod and has done so much in Cape Cod after her stroke. And she really credits with being through Spalding and with NCHPAD and all of the support that she's received, and shared that how much she wants to get out the word, and her message is always be the reason someone smiles. And it's so beautiful to see the smile in her, as we know how difficult some days can be. And we have many other ambassadors, and and it's so beautiful to see too that they want to just be an ambassador because of wanting to give back, because of how much that they have shared, they have received.
So there's so many benefits to this program, and I'll give another just kind of shout out to Patty. A lot of the beaches that you guys go to where you see accessible pathways to get to the beach, Patty has been kind of leading the charge in a lot of places in making beaches accessible. And again, a lot of that connectedness and motivation to do that work is coming from joining a supportive community and then wanting to give back in that way. It's important when you think about NCHPAD to keep several things in mind. So regardless of type of disability, you can be eligible for NCHPAD benefits and eligible to sign up for NCHPAD. And so as you're thinking about other friends that you have or peers that you may want to join this program with you, and you may think, well, I want to join Mentor, but I really don't know what that sounds like, and I'd really love this friend to do it with me. Chances are they would be able to do that with you. Same is true for parents of children with spina bifida or other medical challenges. Parents are often eligible to join these programs as well. The other, just kind of before I talk about the benefits that are on this slide, because I get really excited when I talk about and think about the possibilities within NCHPAD. We are so fortunate that we have Robin on our team, who is a director of this program. And so as we in the spina bifida community become more involved and become ambassadors ourselves, if we see programs that we think we would love to add this to NCHPAD, or this would really benefit our community, the NCHPAD team is so open and willing to hear that feedback. One of the videos kind of spoke to that, of providing honest feedback that then's gone back into the program. And this is a free resource to us. And so I really am hoping that this kind of catches like wildfire within the spina bifida community, so we can continue to make this better for our community. But some of the benefits, again, it's free. It's funded by the CDC, and the CDC really has been for 25 years promoting this program, financially supporting this program, because they've been able to see the benefits. It builds a community, and we've been able to see through stories like Patty and others, just the way that when you do build community and individuals see what's possible, then that just grows and becomes contagious into the ways that it can support other areas. You can participate from anywhere that you have internet access. This program and all of the services are available to you. Again, just having that specialist, when I think about being in the clinic and having families come and tell me that they really wanted their child to participate in dance, but they couldn't find a dance instructor in their area that knew how to provide that for someone that was a wheelchair user. And having a resource like this that you could call and say, I want to find a dance class, and then be the one to sit and make those phone calls and help you find that. That's just a huge resource. And then there's lots of programs that people can benefit from, and we have proven success in being able to see that these programs really are effective in improving quality of life for people with chronic conditions.
Well, now I understand why you're an ambassador, Betsy. I think you could just give this talk anywhere, share the good word for sure. And so here's like the nitty gritty. This is sort of talking you through, okay, sounds great. I get it. I want to do it. What do I need to do? And it's kind of 3 components, but we're really trying to merge them almost into one. But what we need to do is make sure everything's entered the correct way and then complete. So The first part, and we'll actually show a QR code and have a link put into the chat in a few minutes, and sort of do get you signed up already. But wanting to prepare you for what you'll see and also what the questions will be. So we have the first part of it, basic just information about who you are and confirming the eligibility criteria is that you live in the United States and are 18 years of age and and everyone here would qualify. So, you know, it asks the question if you're limited in any way because of mobility and or you use an assistive device like an AFO, cane walker, wheelchair, and it can be occasional use. And so just kind of went over that so that you also know, again, like Betsy's saying, we can be our own ambassadors for others as you see, and you might want your bestie who would qualify to kind of go through it with you. And then what we really want to know is sort of this, in research terms, snowball recruitment, like how you're finding out about it. We want to know so that we can help kind of getting the word out. It does ask some questions about this demographics, your conditions, and introducing a little bit more about the ones that we just talked about, Mentor and Coffee Club and some of the other programs. And what's your preferences? Do you want to be part of any of those? And would you like an expert inclusion specialist to give you a call or reach out to you? So again, that's the person you could think of as like your free social worker, somebody that I have questions and I can get answers. And then the only sort of main requirement is that we, again, because it's funded by CDC, they want to be able to say, this is where we're putting our money, the people in which are in the program, and these are the and then the survey, the areas of need. What are these areas of need? And so it's an agreement to do a baseline survey and then annually. So every year, based on when you enroll, you would be asked to do do a survey, just more to update. And so wanting to find out what's going on. And if you have any of these, it'll be questions around, again, just confirming demographics, your access to healthcare, taking routine health checkups, and any specialist referrals that you might have. And of course, the more you have, the longer the survey. So that's why there's a range here for the number of questions, and ask about lifestyle behaviors, and then some of the management and control of any mental health and chronic health conditions, vaccinations, life satisfaction, and social and emotional support. And really the justification here is we want to be able to say, people who are enrolled in these programs, these are the things that they're facing. We need to be able to support them because this is what's going on for them. And so the more people who enroll, who share what is any of these different domains that they are experiencing, we can then advocate more. So it gives also a justification, sort of like the numbers speak for themselves. We need funding for this because this is what everybody tells us they need. So really this is what happens is, and we can show the link next, is these two columns, the eligibility and screening is something that you can do right now. And then once that's completed, you'll submit it, and then the system does its system thing, and we'll make sure like you're not already in it. And then the baseline survey can be sent to you. And I can go forward. And again, we have our UAB NCHPAD ambassadors, these wonderful group of people who have been ambassadors, and people like Betsy who are out there being the champions and saying, we want to get you enrolled. So I want to say too, before we go to any other slides, but this phone number here, 205-975-8071, is the number that you can call and leave a message, and we'll call you back and help walk you through it as well, as trying to make sure that we follow up with the ones that we have reached out to. And really just to summarize, there are health coaches who are trained to help with all aspects of our well-being. The great thing is you get to interact and be with peers with lived experiences and have access to an inclusion specialist or sort of your free social worker. So now I think, Betsy, are we going to try and
Yeah, so I think we want to go ahead and give you the opportunity to sign up if you want to while we're on the call and can answer any questions or issues that you might have. I saw a question in the chat that was asking specifically about if you're a candidate for the exercise program, if you're not currently a candidate for physical therapy. And absolutely, you can be in any of the NCHPAD programs, regardless of whether you're in physical therapy or not. The criteria to be able to be included, could even be if you live with daily pain and it's impacting your ability to, to live life. And so, it's not based on, your level of lesion level or anything like that, or even what assistive devices you use. It's not based on any of that. And so, you are eligible by having a chronic healthcare condition.
I see a question, and I'm not sure if I'm seeing all of the messages, but the one that I see right now says, how many people are able to participate in Coffee Club at a time? It's a open Zoom call, so you just hop on the Zoom and participate. We've had lots and lots, I think like 60 to plus join at one time. So it's a really wonderful way to connect with others. And Coffee Club is one of those where it's okay if you can't join regularly. That is one that's every other Tuesday. And that is more just as you can think of sort of, I don't know, like a little group that you come and as a support group, as a group that you are able to talk about all things about well-being, and just join as you wish. There is no requirement. And I don't know if we want to, I mean, I could stop sharing so that people, I don't know, can we see each other? Are those who are joined?
I know we can't see each
Okay.
other with this format, with the webinar format. So yeah, definitely encourage, if anybody has any questions about, anything that was discussed today, please, go ahead. It's just, it seems like, it almost seems a little bit too good to be true.
Yes. And if you, so I'm glad that this is going to be, shared afterwards, so you can just click on the, put the link into your web browser or give us a call at this phone number, and we'll be able to answer your questions, walk you through it. We could also, I could go back. I don't know how much we could go through and give a little bit of the clip of Hassan and Emma showing.
Please, that would be great. Yeah, we definitely have some time. So if you want to go ahead, that'd be great.
Okay, I'll stop.
Yeah, I was going to say, Juanita, if you wanted to pull up that link, and then it should go directly to that video that Robin's referencing, and then that'll also show what they'll see when they log into the link, so that they'll know, which click to do.
Okay, great. So then all right, so I'll share. That's the plan. I will share. So this is the page. This is the page that opens.
Right.
Sorry. This is the page that opens when you click on the link that I put in the chat, the address that I put in the chat. This is what will open.
And then if you want to play the little video, if you could move it up a little bit so we could, yeah, great.
So this is,
I
sorry,
was
go ahead.
going to describe who they are. So two of wonderful people who work with us. On the left is Hassan Hawthorne, and he has started working with me as a program manager and helping really formulate a lot of the recruitment strategies with us. And to his right is Emma Taylor, and really so thankful for her work and helping develop the growth program with Kalani Upshaw and Consuelo Click and I. And Emma has a mild form of cerebral palsy and hemiplegia, and Hassan is a lower limb double amputee who won state in wrestling. So excited for him to have done that. But it's really wonderful for them to get in and to be able to share their thoughts on what we're doing. So you could just play the little video. Oop, I think we can't hear. Are you able to maybe?
You can't hear. Okay, so that's probably one of my share settings. Excuse me, just 1 second as I sort that out. Hold on just a second here.
Yeah.
Oh, there we go. Sorry, my Zoom panel is doing fun things. Okay, here we go.
Hi, welcome to NCHPAD Connect. My name is Emma and this is Hassan, and we're here to guide you through the enrollment process to get you connected with resources to improve your health.
NCHPAD Connect is a portal for connecting people with disabilities and learning various program opportunities and resources. To be a part of NCHPAD Connect, you'll be asked some initial questions and interest in program participation.
If you have any questions during the enrollment process, please reach out to Hassan and I. Our contact information will be displayed below.
So that's
Would you
sort of
like
like
me
a little intro to like what to expect once you click on it. And then there's the arrow right there, a little below to that green arrow that you would click next right there. And so then is a little survey that was just what I was showing you is the intake. So it just asks your first and last name, your address, city, state, zip code, email, and phone number. And how did you hear about NCHPAD? So you would click person, and then on the next screen, it would say Betsy, which says a long list of people. And of course, we would say Betsy Hobson. So you would have to put information in here. We could do a test run with this, and we can then delete the, if you'd like to be able to just put stuff in there. Wow, you're very fast.
Well, it's
And then click person, and then so then right at the top is Betsy Hobson, and then you would scroll down and then click. You could also, if you wanted, given that this is with the Spina Bifida Association National, if you were with the one on the previous, that you could say other and write in the National Spina Bifida Association, so that it would be clear that it was Betsy with the National Spinal Bifida Association. I think that would be lovely to be able to document that collaboration here. And so right there at other is where you could type that in at the bottom if you'd like to do that, and then we can
I'll put in that this is a test just so that you know that.
yeah, that's great. That's perfect.
Okay, all right.
And then are you 18 years and older? Yes. And do you experience any limitations of activities due to your mobility? You would say yes here, so that as a test run, because if you say no, then it stops because you're not
Right.
eligible. And then do you now, so this is also, again, it could be an and or. Do you now use assistive devices or technologies such as an AFO, canes, walkers, crutches, manual or power wheelchairs or scooters? And again, just wanting to note, this is occasional use or use in certain circumstances. So yes, test, okay, good. And then you click go. And then
Oh, good
include,
heavens to Betsy.
yeah, that's so cute, Betsy. You can
Oh, yeah.
make one up. You can make one up. Just be 18
Okay.
years old.
Oh, whatever. I can't think of any dates. Just gonna be there.
Okay, yay, we're the same age. What was your biological sex assigned at birth, and do you consider yourself to be Hispanic, Latino, or Spanish origin? What race or races do you consider yourself to be? And then do you have any difficulty walking or climbing stairs? I would say, yeah. I mean, you could say for purposes of doing this, please say yes. Just so you continue to be eligible. Do you use a mobility device? If yes, which kind? Again, this, it doesn't have to be both, and it can be occasional use. And, okay, do you have, this now is gonna be the full list of, different forms of, that can impact you, and so it's gonna go through those. Do you have any difficulty hearing? You don't, for purpose of tests or not, you know, you don't have to have all of these, so you can just randomly go through these if you like. It's not going to kick you out of being able to participate. Just need to have
Now
something.
I'm just randomly clicking.
Yes,
Okay.
exactly. And so they go through the list of 6. Okay, and then it's saying here you will be sent a questionnaire every year to help us further improve our program and service delivery. The questionnaire will be sent via the email address you provided. Does this work for you? If no, which other contact method works best for you? So for here, we'll say yes, it does, and then click the arrow. So we have another wonderful video. Okay.
But this is a different video. Should I click it? Okay.
Yes.
Thank you for providing the information so far. You're almost done. NCHPAD offers several programs and resources.
One of our programs is called Mentor. It's an 8-week wellness program that focuses on mindfulness, exercise, and nutrition. Participants will have the opportunity to take classes in these areas of wellness and meet with a health coach each week during the program to discuss topics as they move through their wellness journeys.
The program requires a time commitment of at least 5 hours a week for class participation and health coaching, so about 1 hour per class. Class materials and equipment will be provided to you for free. You'll be able to choose from different time options per day to attend classes. Currently, the program is being offered virtually, so reliable internet access is needed. Classes will be conducted via Zoom.
The next question asks about program participation in Mentor.
And then you can just go down a little bit to the green arrow. Yep. Okay, so here, a lot of text, but basically it's sharing again about the programs that we have discussed. It says one of our programs called Mentors, an 8-week wellness program that focuses on mindfulness, exercise, and nutrition. Participants will have the opportunity to take classes in these areas of wellness and meet with a health coach each week during the program to discuss more topics as they move through their wellness journeys. The program requires a time commitment of at least 5 hours a week for class participation and health coaching. 1 hour per class. Class materials and equipment will be provided to you for free. Classes will be conducted via Zoom. Would you like to be part of the mentor program? And this is a yes or no. You're not required to be part of the mentor program. Well, of course, we want you to be, and we think you would absolutely love it, but just know it's not required.
I see. So is this the section then where you would sign up for each of the individual programs,
This is
or you get to choose?
right. So this is part of like the sharing with the team what you would like to be part of, so that then you can be directed to the different the call center will then help put you in touch with the different programs that you select or not. And it will also help put you in touch with the inclusion specialist if you need, if you would like somebody to contact you. And the great thing is, you may not want to do it when you're signing up. Say for instance, you're just coming back off of, coming back from vacation or coming back from, being gone for a while or at the hospital, and you're just really not ready to commit to something like that. It's fine to not do them right now. And in this, you could share, I'm not interested now, but I would like to be contacted in 6 months. Can you call me back, contact me in another month? So just know that this is not something like a window of time that you have to do it.
And I think the most important thing to note here is, I think we've gone through probably enough of the steps for people to be able to get the gist, but for the purposes of the recording and the webinar, just really pointing back to that phone number that was on the last slide, that if you get into this process and you get stuck or you don't know how to answer something, then there's always somebody available at that number that will definitely call you back and walk you through all of the steps. It looks like there's one more question. She said, can I watch the whole Zoom again if I come back to this link? I'm very interested and want to join this program. And so that's awesome. We're so excited and we'll love to meet you. So Juanita, you'll be sending out the link so that she can watch this whole Zoom or this whole webinar back, right?
Exactly. Everybody who registers will get an email as soon as the video is ready. And that email will have a link so that you can watch the whole presentation again. And it also has a link to a form so you can evaluate or provide, not evaluate, so you can provide feedback, what you thought about the presentation.
Awesome. And I can put into the chat too, our email, a specific email address just for NCHPAD Ambassador. .edu. And so it's basically that, but I'll put it into the chat as well. So we have a phone number and an email, and would love to, help walk you through it and talk to you about any questions that you might have. And we're happy to schedule a time, so obviously not everyone, in this window could do everything that they need to get registered, but feel free to email us or call us and we can schedule a time to do it with you. We're happy to do it with your friends or family as well. And let me just say, we would love to even schedule a time if we say get, I don't know, 20 of your, best group of friends or, whatever group, we could try to schedule one of the, I can speak to growth because that's the one I'm part of, and could schedule the mental wellness program for a group too, because it's nice being with those that have shared experiences. So thank you.
So those are the only questions that I see now. And thank you so much, Robin. Thank you so much, Betsy, I was so excited about this because I wanted to know more about this wonderful set of programs. So thanks a bunch. And before we end, I just wanted to also share quickly just a reminder that in a couple of weeks, on August 20th, we're going to have our next webinar. This one is it's presented by WellSpect, and it's on bladder and bowel care for children. And it's going to be at 7 p.m. Eastern. And oh yeah, thank you, Robin, for the email address and the phone number. Appreciate that. That's in the chat too. Thank you. So yeah, so again, thank you so much. And unless anybody has any more questions, we will let you go. Thanks for joining us.
Thank you.